right now, osteoarthritis is not really considered or treated as a chronic condition that it is. So we spend a lot of time and money on cardiovascular disease, cancer, diabetes, and those sorts of things, and those are all very, very important, of course. But the point is, people have those things looked at years before they actually get the disease. So you measure people's blood pressure, hoping that they won't get a stroke, or you measure someone's cholesterol, hoping that you'll be able to make a change to prevent that heart attack. Well, we feel osteoarthritis needs to start being looked at in the same way, that we start assessing joint health early and not wait until the horse is out of the barn. And so this kind of approach, really bringing osteoarthritis together with the way we treat cardiovascular disease and diabetes, they frequently exist together. And osteoarthritis is often the thing that doesn't get included in the recommendations for why you need to be more active, why you need to lose weight. We know those things are effective in treating osteoarthritis pain. And so by pulling that together and trying to have a unified way of looking at chronic conditions that exist together, we can somehow empower our patients to demand that they have their joint health assessed and that people be told about appropriate ways of dealing with their risk of developing osteoarthritis. One of our first findings was that African Americans were not spared hip osteoarthritis. There had been a thought that they don't get their hips replaced, and in Africa and the Caribbean, some very, very old studies hadn't seen hip arthritis in Africans and Caribbeans. But when we looked, it looked like there was a similar amount between the two groups. But in fact, what we've noticed now is that actually African Americans are less likely to get knee osteoarthritis than whites, but they're much more likely to have it progress. And we see a similar pattern with the knee where African Americans may have a similar rate of getting the arthritis, but it's going to be more likely to progress. In the knee, we think that's largely related to differences in obesity, but the hip, it's not really clear. We then went on to look at other joint sites, and what we noticed was that the typical hand osteoarthritis changes that we see very commonly in whites, and particularly white women, is something that we don't see very often at all in the African Americans. And then when you look at that osteoarthritis that happens in the hands, it frequently also happens in knees and hips and spine, and that's not the pattern that we tend to see in the African Americans. We see much more hips and spine and knee, and almost nothing that's looking at the hands in association with those things. So why would we be interested or excited about that, you might ask? Well, the reason is because it helps us to try and understand differences that might be causing the osteoarthritis in each of the groups. So we've followed some of that up with looking at genetics and some other factors, and the things that seem to be associated with genetic factors that seem to be associated with osteoarthritis in the whites really don't seem to be the same in the African Americans. So there's some differences in how that works, and then the key part after that is trying to tease that out and figure out which are the reasons.